Assalamualaikum. My name is Sayyida Tuba Saidi, roll number BP 1650232, and today my topic of presentation is lactulose. So, what is lactulose? Lactulose is a disaccharide sugar that contains one molecule of lactose and one molecule of fructose. It is a synthetic derivative of lactose. Lactulose is a laxative that is used to treat hepatic encephalopathy. In the treatment of hepatic encephalopathy, the clinical response is similar to that of neomycin. In 1976, the FDA authorized lactulose. Lactulose belongs to the class of osmotically acting laxatives used in the treatment of constipation. It is used as a food additive to improve taste, promote intestinal health, and promote intestinal transit time. So, what are the indications? The two main indications are portal systemic encephalopathy and chronic constipation. So, portal systemic encephalopathy. For the prevention and treatment of portal systemic encephalopathy, including hepatic precoma and coma as an adjuvant to protein restriction and supportive care. PSC caused by surgical portal cable shunts or chronic hepatic disorders like cirrhosis can be managed with this medication. Chronic constipation. Adults, particularly senior patients, can use it as a laxative to treat persistent constipation. There is no evidence of superiority over traditional laxative. It is used to treat chronic constipation in children. However, its safety and efficacy in children have not been proved. So, what are the precautions? Monitor electrolyte imbalance and lactose intolerance symptoms. What are the contraindications? Galactosemia and any intestinal obstruction. It can be used in pregnancy, falls in category B. Other animal reproduction studies have not demonstrated a fetal risk. There are no control data in human pregnancy. Lactulose should only be given during pregnancy when need has been clearly established. Can be used in breastfeeding. There are no data on the excretion of lactulose into the human milk, while the manufacturer recommends cautious use during lactation. What are the preparations available? Oral solution, powder for oral solution. It can be stored at room temperature between 15 to 30 degrees Celsius. Keep away from light and moisture. Keep away from children. What are the side effects? Gas, bloating, burping, stomach ache, nausea, cramps may occur. So, what are the dosage? Adults above 18 years 15 ml twice daily. Child under 1 year 2.5 ml twice daily. Children 1 to 5 years 2.5 to 10 ml twice daily. Children 5 to 18 years 5 to 20 ml twice daily. Adjusted according to response. May be taken with or without food. May be taken with meals to reduce GI discomfort. Dilute with water, milk or fruit juice to improve taste. So, what are drug interactions? Lactulose has no known severe interactions with other drugs. Lactulose has no known serious interaction with other drugs. Moderate interactions of lactulose include ammonium hydroxide, calcium carbonate, sodium citrate, citric acid, sodium bicarbonate. So, what is the drug mechanism? Lactulose is broken down by bacteria in the colon into compounds that bind ammonia, which is thought to be the toxin that causes hepatic encephalopathy. Ammonia binding stops ammonia from migrating from the colon into the bloodstream while simultaneously drawing ammonia from the bloodstream and into the colon. While the other mechanism it is that it is not broken down by human enzyme and thus stays in the digestive bolus through most of its course, causing retention of water through osmosis, leading to softer, easier to pass stool. Osmosis is a process by which molecules of a solvent tend to pass through from a less concentrated solution into a more concentrated one, thus equalizing the concentration on each side. Its onset at 48-hour metabolism, lactulose metabolized in colons and excreted in feces urine as unchanged drug. Brands available are Lilac, Dufelac, and Colac. Irrational use of lactulose. In roughly 20% of people, lactulose can cause gaseous distension, flatulence, or belching, as well as stomach pain such as cramps. Excessive dose might cause diarrhea, which can lead to dehydration, hypokalemia, and hypernatremia, among other consequences. There have been reports of nausea and vomiting. So, now we have to discuss the case study. A man aged 74 years presents to the pharmacy asking for something to help him manage his constipation. He explains that it comes and goes, but he was hoping to speed it along this time. Subject: Person ages 73, weight 72, height 5.6 inch with the complaint of constipation with no history of medication for constipation. His lipid profile is normal, creatinine is normal, there is no microalbumin, so chronic constipation is detected. So what was the plan? Lactulose 30 ml once a day. And what was the non-pharmacological plan? Increase your fiber intake. Adding fiber to your diet increases the weight of your stool and speeds passage through your intestine. Exercise most days of the week. Do not ignore the urge to have a bowel movement. Reference: pharmaceuticaljournal.com, web.com, and nhs.uk. Thank you.